Okay, great. Good afternoon, everyone. Thank you so much for being here. I'm going to tell you a little bit about Thriveat Home. You should have some information in your packet, but as Jameson said, reach out to us. We certainly want to be able to answer all of your questions, and we'll do some question and answer, both for myself and for Tricia, but also for our members. They're going to tell you their experience better than we can. So Thriveat Home is what we call kind of a comprehensive plan for you to think about your future. So long-term care requires a lot of coordination, and trying to navigate the home care systems and the medical systems and all of that we have, our healthcare system in the United States can be difficult. It's difficult for us who are even in it. And so what Thriveat Home does is it creates a partner for you to be able to have somebody along the way as your needs or your care needs change, that you can have a partner to be able to do that. We provide personalized care coordination, and we deliver the services that you may need to you in your home. It's called if you're doing any research, it's called a continuum of care at home, continuing a CCAH, that's kind of another word that you can use, a life plan at home program. So if you're doing any kind of general research, those are the terms that you'll use. But what it really does is it financially covers the cost of any care that you may need in your future. So if you think that you might need the assistance of, say, a home health aide in your future, if assisted living is necessary, nursing home care is necessary, all of that is covered under the program. Jameson already talked about Senator McLean and why McLean is offering the Thriveat Home program, so I won't go into that in detail. But let's start with kind of a little bit of a did you know. The average American couple can expect to spend over $300,000 in their lifetime for future medical costs that are not covered by your medical insurance. So they're not covered by traditional Medicare or a Medicare Advantage plan that you might have, even a private insurance that you have. What Thriveat Home does is cover those costs of those out-of-pocket expenses that you may have. 75% of us over the age of 65 will need to use some sort of long-term care services or supports in our future. It's quite a high number of us, but only 30% of us believe that we will. So you can even imagine that less of us plan for it. So the fact that you're all here means you are way ahead of the game. You are those stellar planners that are looking to plan for your future. 58% of us will need what we call substantial long-term care services. 20% of us will need it for longer than 5 years. And then we as women, we tend to use it a little bit longer than men, typically because we live a little bit longer, so about 4 years compared to 2. So that kind of helps kind of put some perspective of why a Thriveat Home program even exists. So as I mentioned, Thriveat Home is really about a partnership, and certainly Tricia's going to go into a lot of that later. But our job is not to tell you how to live and tell you what to do, but it's to partner with you so that you can make educated decisions about what you want your future to look like and how you want care and service to be delivered if that's what you're looking for. We do provide annual visits and assessments. We provide home safety evaluations. And so what part of when we think about planning for long-term care services is making sure that your environment works for you. Sometimes people are saying, I need help and support, and you need to bring somebody into the home, and we just need to make accommodations to your actual physical environment. And then, as I mentioned, we do provide that hands-on care when you need it, and support for that. And what we do is we provide that support when what they call activity of daily living is necessary. So that ADL, or activity of daily living, is kind of the medical definition of when somebody needs hands-on care. Most long-term care insurances, if anybody here has long-term care insurance, does anyone have that? Okay, great. So typical long-term care insurance will require you to have a deficit in 2 or more activities of daily living before those services you're qualified, or they'll pay for any of those services. Thriveat Home wants to be much more proactive. So the second that you need care and service, any kind of support with just one ADL, that's when our program kicks in. And as I mentioned, we organize that care and service to you in your home. We work within the current system and navigate it on your behalf so that you don't have to. If you're dealing with an illness or an injury, that's what you need to be focused on. You don't need to be focused on trying to make 100 phone calls and trying to figure out what's the correct level of care or support that you need. That's what you're going to rely on us for. This here is a lot, I realize that, and we can provide this to you as a take-home if you wanted that. We can certainly email it to you, but I give it to you in case you're doing that research. Long-term care services and supports is a lot. There's a lot out there, and there's a lot of us where our names sound very similar, but we do very different things. So this program is called Thriveat Home, but there's another program called Lifetime Care at Home. Lifetime Care at Home sounds very similar to Thrive, but Lifetime Care at Home is actually a homemaker and companion agency. So if I can get this to work, right here. So you can see it only covers 3 of the services that are up here compared to Thriveat Home. That is very comprehensive and covers so much more. So I leave this in here and provide this to people so that when you're doing your research, you can compare apples to apples versus like apples to oranges. Thriveat Home was really created to help you guard against that future cost of care. Healthcare is very expensive. It gets more expensive every year. It certainly got very expensive after COVID. But if you look at the cost of care compared to Thriveat Home, assisted living services today will cost you over $100,000 for the year. If you look at a nursing home, that'll cost you almost $200,000, and that's just the average in the Hartford County area. When you go out just 10 short years here or so, 9 short years, you can see that the cost of care rises dramatically. So long-term care or nursing home care will cost over $300,000 by 2035, and that's an estimate. But if you're a Thriveat Home member, you're going to have one low steady cost, so you'll see that it's going to go up just a little bit every year. And so what essentially you're doing is prepaying for any care that you're going to need tomorrow with today's dollars. Let's get into some of the benefits. So as I mentioned, that partnership, we have a team of what we call personal service partners or care coordinators. And that team of personal service partners, our job is to get to know you, get to know the important people in your life, get to understand what you want your future to look like, what your goals are, so that we can help you not only manage your health and service now, but anything that you're going to need in the future and make sure that it matches. We develop a well-being service plan with you, again, taking into account your goals and your wishes, and we focus on wellness and prevention if we can. So if we can get you involved with physical therapy, for instance, before you have a fall, that would be our goal. We are on call 24 hours a day, 7 days a week for your care-related needs. So, we realize that you might end up in the hospital on a weekend. People fall. There's accidents or illnesses that occur. And so we want you to be able to get in touch with us so that we can start working with you and working with your care team for any kind of post-hospitalization care that you might need. We coordinate those future care and services that you need, and we can serve as those kind of a navigator, an advisor to kind of understand kind of the system you're working in. I kind of joke with people a lot that I'm the last person you want doing your taxes. I don't even do my own taxes. I don't even want to try to understand what that should be. So I outsource it. This is what Thriveat Home is. You are outsourcing the expertise of the long-term care kind of services and supports kind of field, both to Tricia, myself, and our team. And we do participate in inclusivity and sensitivity training so we can better serve our LGBTQ seniors as well. We do cover that continuum of care, thus the name, Continuing Care at Home program. So the services that we can provide to you in your home are a lot. So we have personal care services or home health aides. That's somebody that would be able to provide you with hands-on physical care. We do offer homemaker companion services should you need that, and that can help you with maybe going to the doctor, running errands, transportation, or just safety and queuing in the house. Our program also covers live-in services. So if you have a condition that required you to have the support of somebody in your home 24 hours a day, the Thriveat Home program would cover that. We also provide you with a personal emergency response system. So you might be familiar with like the pendants that people wear either on their wrists or around their necks. We provide that as part of the program. We also provide medically necessary transportation and meal delivery. So if you're having surgery, you're having your colonoscopy, your cataracts removed, anything like that where you're going to be sedated and it's not advisable for you to drive, that's when we'll coordinate your transportation for you. If you have an extended illness that is going to prohibit you from really cooking and making sure that you're getting your proper nutrition, we can deliver meals to you in your home during that period of time as well. And as I mentioned, we want to make sure that your environment works for you as much as having care and services delivered to you in your home. So as part of an ongoing benefit of Thriveat Home, every other year as part of your membership, we'll actually come out to your home and evaluate to make sure that your home is actually working for you. And then of course, there are services outside of your home. Now I know that nobody plans to want to move into assisted living or a nursing home, but sometimes that is necessary. And so the plan does cover that, Thriveat Home covers that. So the services outside of your home could be adult day health programs, outpatient physical therapy, short-term rehab, assisted living, memory care assisted living, home care and hospice, or nursing home care. So all of that, most of that can be provided right here at McLean, and of course that is our preference, but if that's your preference. As I mentioned, it's not our job to tell you how to live your life, but it's our job to help you make educated decisions, and McLean is one of the top providers in the area, and that's our program. One of the other benefits of a Thriveat Home membership is that you get membership to what we call, it's a company called Thriveat Home Concierge. So Thriveat has been a partner of ours for many years now, and what they do is they vet any kind of service referral that you might need to help you manage your home. So say you need technology support, you want to set up something in your home, whether it's your computer or setting up security cameras. If you need a plumber, if you want somebody to come out and do all the snow plowing or the leaf raking or just cutting the grass, all of that, Thriveat will find those trusted vendors for you. So they do all the background checks, they make sure they have the right insurances, all of that. And if you're using multiple services, what they will do is Thriveat pays those vendors directly so that you don't have to do all of that. They will coordinate it for you and then they'll consolidate it all into one bill for you, trying to make your life just that much easier. Thriveat's great, I actually use them myself in my home. Some of the other benefits is that you get access to Boundless Wellness. So you become a McLean Boundless Wellness member. So right around the corner here, they have a very impressive gym and classes, a variety of classes that they offer so that you can maintain your health and fitness and your movement goals. So you would get access to that. You can certainly come to the campus and use any of the amenities of McLean. You have your priority waitlist placement. So if you wanted to move to McLean, whether it's independent living or if you were looking based on your care and service needs, if you wanted to come and live in assisted living, you would be able to get priority access to McLean above anybody out in the general public because you're already under the umbrella of the McLean family of services. Another benefit of Thriveat Home is that if you do have long-term care insurance, and there's a fair number of you who do have it, is that if you keep your long-term care insurance, we will submit all of those claims for you on your behalf. So again, you can just worry about getting over your illness or your injury. We'll take that administrative burden of submitting claims to long-term care insurance for you, and we'll do that on your behalf. And then your membership is portable. So after a year of being a Thriveat Home member, should you decide Connecticut is not the ultimate place that you want to retire and you want to go move somewhere else in the United States, we can follow you anywhere that you move. We actually have members that live permanently in Massachusetts, Maine, and Oregon right now. There's a lot Thriveat Home offers, and I don't ever want to give the impression that it's kind of too good to be true, because I've heard that before. So let me be very clear about what Thriveat Home is not. So Thriveat Home is not a health system. So you are still going to maintain your health insurance, whether that's Medicare or Medicare Advantage, or some other kind of private insurance. So your medical insurance, your physicians, all of that is still going to remain yours, and they will cover all of your kind of acute medical needs. Thriveat Home is not going to do that for you, but Thriveat Home is going to cover those long-term needs that you're going to require that, again, your insurance doesn't cover. Our job is to understand those systems, kind of beyond the hospital, beyond the doctor's offices, so that you don't have to. We are also not a health insurance. So your health insurance is going to pay for your doctor, it's going to pay for your hospital stays, that sort of thing. We're not that health service or that health system. So when you are being discharged from a hospital, for instance, a lot of times they say, follow up with your doctor. And they want you to see the doctor within like a week or two. I wish I had the kind of pull I could call everyone's doctor to say, my member needs to get it and it needs to see you sooner. Unfortunately, we're not connected that way, so you would have the same kind of waits that everybody else does. And then we're not that concierge service, but Dorvey can be. So Dorvey can help you figure out pet care, again, a plumber, anything like that that you might need. But Thriveat Home itself doesn't have a team of kind of physicians, nurses, certified nursing assistants kind of waiting to be deployed to help you. So again, we navigate the current system, so there might be some waits, as I mentioned. Typically, we can get care set up anywhere from like 24 to 72 hours, but that's kind of what we tell our members to say, it could take that long to get things set up. So again, if you call to say, oh, I'm not feeling well, I don't have anybody that we can just deploy in that moment. So let's talk about the membership options. So with Thriveat Home, there are 4 different membership plans. All of them are lifetime plans, so once you're a member, you can remain a member for your lifetime. And we have a daily max. We pay up to what it costs to be in the nursing home. So this way, nursing home care is the most expensive type of care, as you saw on those graphs earlier. It's the most expensive type of care that's out there. So if we can provide the care and service to you in your home, you have a lot more options and a lot more that you can use in your home because you have that daily max of nursing home care. We have a one-time membership enrollment fee that's based on the plan that you choose, so the level of coverage you're looking for, as well as your age. And then we have a monthly service fee. And the monthly service fee is just based on the plan. It's not based on your age. It doesn't go up as you get older. It doesn't go up as you start to use service. It's just the plan's monthly fee. We do offer refundable options. So that one-time membership fee, if you were interested in having that refunded back to you, either upon your passing or if you decided to cancel your membership, 100% of that one-time fee would come back to you. And we also offer a discount on the monthly fee for 2 people of the same household who join the program together. And one of the really nice benefits is that all the fees that you pay are tax deductible at 85%. So you are prepaying for your medical care, so just like those of you with long-term care insurance and you write off your premiums, you can do the same thing with Thriveat Home. This should be in your packet as well, but these are the 4 plans that we offer. So everything on the left-hand side you'll see is everything we just reviewed of all the benefits of both in your home and outside of your home, and then the different levels of coverage. So you can see our Diamond plan. Our Diamond plan here is our all-inclusive plan. Our Emerald and Ruby plans are what we call our cost-sharing plans. So under the Emerald plan, Thriveat Home would pay for 70% of the cost of care and service that you need. And under the Ruby plan, we would pay for 50%, and then you would pay for the difference. And then we offer our Sapphire and Topaz plans, and those are just our care coordination only plans. So if you have a very robust long-term care insurance plan, but you want the care coordination piece, that might be an option for you. It could also be for somebody who wants to self-insure, for instance, but wants kind of that help and support of care coordination. So to become a member, you do need to qualify medically and financially. So we do have disqualifying diagnoses. So if you already have a diagnosis that is neurological, degenerative in nature, then you wouldn't qualify for Thriveat Home. We do offer companion memberships, so if we have 2 people from the same household and one doesn't qualify medically but the other one does, it never felt good to us to say, well, I can help you but not you. Because we know that 2 people who live together, you function as a unit, you're a team. And so we wanted to honor that. We can still provide you with the care coordination, but we just wouldn't underwrite the cost of your care. Of the financial qualification, it's a very simple confidential financial statement that you complete. But the health qualification is actually very extensive. So part of the health assessment is that we would look at 2 years of your medical records. We send a statement of health to your physician to complete about you. We also provide one of those to you. You would complete it about yourself. And then after looking at all of that, we then come out to your home and we provide some additional health screens. And those additional health screens will look at a variety of things. We'll look at kind of your emotional health, we'll look at your cognitive health, as well as your physical health. So there'll be some different kind of balance tests and walking tests that we do as well. Then we take all that information, and that provides us with kind of a risk profile and lets us know whether somebody qualifies for the program or not. The goal is to join the program when you are healthy and independent. So just like, for instance, your homeowner's insurance, right? You would never call up at homeowner's insurance and say, I need to insure my house as it's burning down, right? You wouldn't get into a car accident and then call Amica and say, I need car insurance after you had the accident. So that's what the Thriveat Home program is like. You would join before you need that care and service. Here's just another example. I shared earlier kind of the cost of what the future would look like for either home care, assisted living, or nursing home care. This looks at it a little bit differently, but projects it out over a 3-year period of time. So we're looking at this, and again, this is just the Hartford area. So in 10 years, say somebody needed 3 years of care. Home care services at 4 hours a day, 7 days a week, will cost you almost $500,000 over that 3-year period of time. Assisted living over that same 3-year period of time will cost almost $650,000. Nursing home care during that same 3-year period of time will cost over $1 million. That's staggering, you know, and when I think about that, I mean, if I have $1 million, I don't think I want to spend it on nursing home care. I want to do something better with that money. I want to use it the way I want to use it. But over that same 3-year period, Thriveat Home, you're going to just be paying your monthly service fee. Because as I mentioned, that monthly service fee does not increase if you need care and service. You're still just going to pay the same monthly fee as everybody else. So that monthly service fee for a Diamond member over that 3-year period of time is just over $40,000.
Is that a year or for 3 years?
That's for the 3 years. So here are some examples of kind of what the cost would be and what Thriveat Home can do to support the members. So say you're 70 years old, you're a Thriveat Home Diamond member. The Diamond plan is our 100% covered plan, our all-inclusive plan. You would pay a $73,400 one-time membership fee. The monthly fee would be $816 if you're an individual person. If you're a couple, you would pay $641. I mentioned that little bit of a discount. So say you needed support and coordination, you're having a joint replacement, a hip, a knee, anything like that. Thriveat Home, your personal service partner, and you would start to plan for what your post-hospital needs would be, what you're anticipating. Your doctor has said you're going to need for supports. We'll take a look at your home. We'll understand kind of what you were like before you had your surgery and start to plan for that. We can coordinate any kind of short-term care that you might need right here at McLean and have that ready for you and waiting. And certainly if you needed any in-home care after your discharge and even after your discharge from McLean, then we would coordinate all of that care and service to you in your home. So that could be physical therapy and nursing, and that could also be done by McLean's home care and hospice team. We could supplement that with a certified nursing aide, somebody to come out and provide you with that hands-on care in your home. We could deliver the durable medical equipment or the DME that you're going to need at that time. So whether you need a walker, if you need a raised toilet seat, again, looking at your environment and how it works for you. And then of course you can, after all of those different levels of care, you can also come to McLean for outpatient physical therapy. And then continue your rehab and your focus on strength and movement with the Boundless Wellness Gym and the classes that they offer here. Say you're 80 years old and you've joined the program, but now you're 80 and you're living at McLean. An 80-year-old who joins the Emerald plan, which is our 70% coverage plan, would pay a one-time fee of $58,200. Your monthly fee would be $670 and a little bit less, $554 for each individual of a couple. You would still be responsible for 30% of the cost of care under this plan. And if you're living at McLean, you would also have your McLean monthly independent living fee as well. So say you had an unexpected hospitalization. what would Thrive do? Your personal service partner would follow you throughout your hospitalization. We would be talking to your medical team, the discharge planners at the hospital, trying to anticipate what you're going to need when you go home. We would work to see if there's any care and service that you would need here at McLean to be delivered again to you in your home. We would coordinate anything that you needed for a Medicare certified home care stay, so again by McLean's team. And then we could supplement anything that you need through aides again. And then we would deliver meals to you if you needed that during your time if you're recovering from a joint replacement. And then here, a 75-year-old who joins the plan under our Ruby plan. That's our 50-50 shared plan. You would be responsible for 50% of the cost of care. We would pay for 50% of that cost of care. You can see that as you go down in the coverage, your one-time fee lowers. So your one-time fee would be $41,700, and your monthly fee would be a little over $600. It would be $500 a person if you were a couple. And say you just needed ongoing assistance with those ADLs or those activities of daily living that I mentioned earlier. Your personal service partner would work with you about getting certified nurses aides to come in and be able to help you with support. We would coordinate an occupational therapist to come out and evaluate your environment and any enhancements that needed to be made. We could arrange for that durable medical equipment that you would need based on your condition and the services that you would need. Dorvy might be a really good option at this point. So maybe Dorvy needs to come in and start handling home maintenance needs that you have. You no longer can, do the lawn service. We would be able to get Dorvy set up so that you had a trusted vendor to do that. And then if you had long-term care insurance, we would, again, submit all those claims for you. For those of you who do have long-term care insurance, this is just a nice side-by-side comparison to show you some of the differences. It's similar to long-term care insurance, but with a little bit more kind of extra. There's some additional benefits. So typically with long-term care insurance, you are left to coordinate all the care and service that you need on your own. So whether it's you needed help at home or you needed help in a facility, whatever that is, you are then responsible for figuring all that out, making sure, getting it all set up, paying the provider directly, and then gathering the bill and the evidence that your insurance is going to need. You submit those claims and they reimburse you. Thriveat Home, we pay our providers directly so that you don't have to worry about that. There's no paperwork that you need to do with us. Typically, there's a waiting period if you have long-term care insurance. Long-term care insurance, the waiting period I've seen as little as 30 days. I've seen it as high as 120 days. Typically, it's about 100. And so you might be eligible for care and service according to your plan, but you need to pay for the care and service in those first 100 days before your insurance will start to reimburse you. Typically, you have a deficit in 2 or more activities of daily living before that you're eligible for services. With Thriveat Home, of course, we only have the 1. And there's no policy limitations. As I mentioned, once you're a member for your lifetime. We're not going to say that you only get 2 or 3 years of benefit. You get benefits for as long as you're a Thriveat Home member. And if any of you have seen your premiums increase, I know that Judith did. So if you've seen your premiums increase, they go up pretty dramatically with long-term care insurance. With Thriveat Home, historically, every year, the monthly fee will increase about 4%. That's been our average over the last 10 years. Okay, a lot of information. I feel like I just opened up a fire hose and gave you information on Thriveat Home. I hope that you have been recording your questions. I would like to introduce the panel though. Certainly ask any questions of any of us. And we'd just like to open it up for discussion. Tricia, do you want to start and maybe talk a little bit about the personal service partner team and how we all work together?
Sure. Can everybody hear me okay? Okay. Yeah, so again, my name's Tricia DeLella. I am the program manager at Thriveat Home, and I also function as a personal service partner, which I'm sure you've learned is just a fancy term for a care coordinator. I actually have been with the Thriveat Home program for almost 9 years. My background, A lot of my work is in nursing homes, where I started off as a social worker and then spent many, many years, almost 11 years working in long-term care as the director of social services. During that time, I also oversaw the memory care unit in that setting. And then Michelle and I actually spent some time working together. We worked together for the Quality Improvement Organization for the state, where we did lots of work in the nursing home setting, trying to help nursing homes improve their star ratings. And really, that's where I have really just developed this passion to support individuals really where they are in life, because my goals are going to be very different than your goals. Everybody's goals are different in life, and I really believe that that's where we are set apart from long-term care insurance. So we really hone in on that personalized piece of the work that we do. Spending time, myself, my team, spending time getting to know you, getting to know what's important to you. What are your goals in life? And sometimes I'm sitting across from somebody and they say, Trish, I don't know. So it's one of those things where we're going to sit together and we're going to build those connections and those relationships, and that's going to build the foundation of really the work that we do. So Michelle touched a lot on kind of the logistics of what Thrive at Home does. I believe our team provides that personalized, that personalized piece of the journey to kind of go through all of those steps. And I always say, bounce questions off of us. We're there to answer questions that you might have. And by a show of hands, has anybody in the room been somebody who's helped coordinate care for a family member, a loved one? Yeah, so quite a few of you, and I'm sure we share the same kind of feelings about it. It's hard, and the healthcare, scene now, it's challenging. Nothing about it is easy, and I always say, I'm never gonna make anything perfect, but I'll be there on the back end to help support you to be able to navigate through hard situations, and just try to make the process as smooth as possible while we go through, our journey together.
Judith and Fred, do you want to share a little bit about your experience being members with Thriveat Home?
Yeah, I think I can add some sort of personal description of what has been described as what the program is. My wife and I joined Thriveat Home. We were the first members in 2016. What happened at that point, she had been diagnosed with mild cognitive impairment. And so when we met with Thriveat Home, she was not acceptable, but on a risk-based contract, but it was acceptable because I was acceptable on a risk contract as a companion, so she had coverage on an a la carte basis. That turned out to be a wonderful solution for me because her disease progressed. And in the first phase of her disease, we needed help at home, and Thriveat Home provided the aides. I didn't have to hire them, I didn't have to supervise them, I didn't have to pay them. I could have, I had the capability of doing that, but I had other things to do in my life, and so it was really, really helpful to do that. Also, at the beginning of it, we really took a look at the house we lived in, and staff from Thriveat Home came over and gave us several suggestions on how we could live in this house safely and comfortably throughout the rest of our lives. That was also a very helpful service. As my wife's disease progressed, the need for aides increased to the point that we finally had an aide living in full time. And that was very helpful up to a point when it all became clear to all of us that that was no longer going to work, and we had to find a place to place my wife in a memory care unit. Thriveat Home was very helpful in that process of helping us select a place that would meet our needs. And so we had my wife move into this place. Through all of this, there was also the staff people keeping track of what was going on with us. And just as some anecdotes or examples of what happened, I was out skiing in the West one time, and my wife, who was living in the member unit, got into a conflict with another member and got hit over the head and had to be taken to the emergency room. Now, at this point, she was very far in her process of dementia. She had no idea where she was. I was totally freaked out. They sent her to the emergency room. What was she going to do? Who was going to be there with her? And Thriveat Home staff heard this, and the staff actually was with her in the emergency room, pushed the process through to where she was able to be released the next day. She really didn't need to be there. I think as we reached the end of her life, it became clear to me that I no longer needed to live in this large house. And so because I had this contract with Whitney Center, Thriveat Home, I was able to jump the waiting list and move into an apartment there. And the other piece of it that I would just comment on is blending the services of Thriveat Home staff with my long-term care insurance, which, by the way, paid almost $350,000 to care for my wife, was wonderful. The long-term care insurance wouldn't have provided any of that. The staff at Thriveat Home did all the billing, made sure everything worked, helped us coordinate any kind of questions they had about whether or not she was eligible for care or what levels of care she needed. So we come to where I am today. I'm getting ready to go into a hospital for a procedure, which I'll leave confidential, and unless you want to know. But all of us at this stage in our lives have organs that don't work like they should, so we have to find the doctor to which to take the organ. Anyway, Thriveat Home is already working with me about while I'm in the hospital, after I come back from the procedure, what kind of aftercare do I need? This is a huge relief to my family, who really appreciate having this. And one last comment, that while we were in the early stages of my wife's care, I have a blended family, and my kids were in significant conflict with me about what was the best thing for her to do, for us to do with her. And the staff at Thriveat Home facilitated several, which were family therapy sessions, quite honestly, to us, as we worked through what was going to be a solution that we could all agree to.
Hi, is this working? My name is Judith, and I'm a resident at Whitney Center in Hamden, where Thriveat Home started and is growing rapidly. We're very proud of it. And I had long-term care insurance when I came into Whitney Center. I've been there now 2 years. And the long-term care insurance, I'll even mention the name of the insurance company if anyone has it, is Genworth. Does anyone have Genworth? Oh, well then you know what has happened to the price of that insurance. I actually took on that long-term care insurance when I was 58 and my husband died, so I've had it for a long time. But they have repeatedly been sending out letters asking people if they want to drop some of the services because the cost was getting so prohibitive. And I think we're going to see that over time, that you can expect a 4% or so cost every year. But when they sent me the bill for $22,302, I said, I think I'm going to look at another insurance company. But we had the Thriveat Home at Whitney Center, so Michelle pulled me in and we talked about converting. So I see the Thriveat Home program for me. I don't need any of the services right now. I have my own apartment at Whitney Center, and I may be 3, but I think that in the next 10 years that I may be needing services. And now I feel secure because I know the entity They do all the paperwork for you, which I would really appreciate. And I really feel like the difference between what I'm paying for Whitney Center insurance, that is for Thriveat Home, and it's a substantial difference. I can tell you that I'm paying annually now $7,200 for my long-term care insurance, where I was paying $22,000. The difference I put into a savings, a health savings account, and I feel very, very comfortable with that. I know the entity, it's right there. They give you a personal assistant to do all the paperwork that I don't like to do, as well as taxes I don't like to do. So I hand them over to people, and I don't mind paying for the service. But I've only been in it now 1 year, so I haven't used any of the particular services. But I expect that I'm going to feel very comfortable in the future when I do need them, because Whitney Center is my home, and the services will be delivered right there. So I'd love to answer questions if you have any, and if I could be helpful.
Thank you all for sharing. All right, so let's open it up for questions.
Yeah, I'll run this. Oh, we'll do that one. So if you have a question, just raise your hand and I'll come to you with the mic so that everybody could hear it. And we're also recording this so people can see that couldn't make it.
Okay, I hope this isn't a silly question, but I was a little confused about the cost here. So let's say there's a 77-year-old and an 81-year-old living in one house, right? So does that mean we pay two fees, a 71-year-old fee and an 81-year-old fee? Or if we only pay one fee based on whose age? I'm confused because you're mixing the fee and then the two-person household over on the right. It makes no sense to me.
Great question.
You got
Great question. Everyone hear me? Okay. So great question. So every Thriveat Home membership is based on an individual. So you're going to qualify individually. So you do pay the one-time fee per individual. You base that on your age. And then if those two people from the same household are joining, then you have the discounted monthly fee that each of you would pay.
Okay. Thank you.
All right. Let's get another question up here. Okay, to get my steps in.
Say one of the spouses is of this age, but the other is younger, so obviously she would have to wait until she hits 61 to also do it, or can she sign up at her present age?
She can sign up at her present age. Our youngest member signed up when he was 48 years old. So we have more pricing, absolutely.
Oh, so it would be obviously just another scale.
Yes.
You just didn't
Yep.
know that.
The younger you are, the less expensive
Right.
it is for that one-time fee.
Okay, and say you're a couple and at some point one person has one of the ADLs or whatever and requires assisted living facility. Could the other one also go to assisted living, or do they have to have the ADL? Like, I don't know, this gentleman, he stayed, was that a choice or was it a requirement, and who decides?
That's a great question. So when you're talking about whether you move into an assisted living, whether that's assisted living memory support or a nursing home, there are actually like rules and regulations that organization needs to follow. So as long as you can meet the care requirements for that level of care, then you can move in.
Okay, any other oh boy. Okay. So I know we're not going to be able to get to everybody's questions, and I know there's going to be questions you're going to think of tonight, and that's why we're doing that other session. Now hold on.
Okay, hi, thanks. Okay, so I'm a little confused. So if you are a member and you're paying your monthly fee, is it more like a aging in place? So would that cover you going into assisted living or long-term care based on those needs that you would have at that monthly fee that you're paying?
Yes.
Okay, and that would be at McLean?
Yeah, in McLean or wherever you choose.
Okay, but it could,
If you choose McLean, it would be McLean.
okay. And so, just real quick too, I'm a little confused with, but I probably more detail than you have time for. It says that you don't take chronic medical conditions, but I'm a little confused about that because people can live in their homes independently with chronic medical conditions. So,
Yeah, so we understand that as you age, things happen, right? We all have conditions that we manage, and so as long as you're managing your chronic conditions well, and you still are able to function independently, you would qualify for Thriveat Home. When somebody's got multiple comorbidities that they're not being managed well, then that would disqualify them from the program.
but when they go in, their status could change, so that's what I'm saying. So it's a continuum of care. So as their status changes, then they can move to the next levels.
Yes, yeah. So once you're in, you're not gonna be disqualified if you have a diagnosis years later.
Okay,
Exactly.
thanks.
I know there was a couple, I'll get to you, there was a couple, having choice is important. That's one of the big benefits of Thriveat Home with McLean, but you do have access to our continuum of care.
I have a question about the term Thrive at Home. Is that a unique program for McLean, or can you have a Thrive at Home program at Doncaster and so on?
So, good question. So, Thriveat Home with Whitney Center started 10 years ago at Whitney Center, which is located in Hamden. So, we have recently partnered with McLean, and so we're offering Thriveat Home with McLean. So, it's the same team of personal service partners, it's the same kind of membership that you would use, but it's just in 2 different locations. Wherever you call home, though, is where Thriveat Home is going to follow you. So, if you live at Doncaster, we would follow you to Doncaster and provide for your care and service there, or pay for Doncaster to do that.
Thank you.
You're welcome.
This is an easy question. Could you send us copies of your slides?
Yeah,
To
happy to.
people who have registered? I think we gave you emails.
Yep.
That'd be great. Thank
Happy
you.
to do that.
Thank you.
Like McLean, is Thrive a nonprofit?
Yes, we are a not-for-profit, absolutely.
And you have a financial statement?
Yes, yeah, we do have a financial statement. You'll see who's on our board. You have 4 years of our audited financials to look at, anything you want. We're very transparent.
Great.
Okay. Any more questions for now?
Do you have any McLean people in the program yet?
Yeah, so great question. We actually just launched in January, and we have 2 Thriving Home with McLean members already, and we have 4 more people that are going through the process.
That's a good question too, because when we launched in January, we called it kind of like a soft opening in a way. We launched in January through March with what we call Friends of McLean. You know, we introduced it to residents, volunteers, committee members, steering committee members, just people who were engaged with McLean before we went public. We actually just went public with this program April 1st, so it's generally relatively new.
Very brand new.
It is very brand new, yes. Any other questions for this evening? Okay, well, like I had mentioned, I think, you know, we got through this in good time, so that's very exciting. You have time to enjoy this beautiful day, but I know questions will come up. You have a lot of information that just came at you. You have a lot of information in your packets, so we're sticking with that follow-up session. We will send out an email with a link. It'll be in about a week to 10 days, we think, because we want to keep everybody fresh and this fresh information in your head, but when we send that out, we'll have you respond with any questions that you have, but it'll be an open forum question and answer session. And we just thank you so much for coming to McLean, and yes. Oh my goodness, thank you, Janice.
And M&Ms.
Okay, gotta take your M&Ms. You don't have to take your M&Ms, but please take your M&Ms. And please fill out this, this quick little survey. It kind of will help us navigate. You know, we want to do our best. We pride ourselves on customer service here at McLean. We want to do our best to follow up with people who are most interested. And if you're not interested at this time, let us know so that we can follow up with those other people. So again, thank you so very much and have a wonderful evening.
Thank you all.